Hello all, good evening. So in today's talk show, we have Dr. Mahadev Potharaju with us. So before getting into the talk show, I would like to present a heads up about cancer. So where are we heading to? Cancer is the leading cause of death in the world. It affects 1 in 3 people worldwide. The number of Indians suffering from cancer is projected to increase from to 29.8 million in 2025 from 26.7 million in 2021. So, awareness is a must in order to know more about cancer and what is happening in the cancer research, in the cancer field, and what are the treatments available, and also how to prevent them. So, in this digital era, information travels much faster than cancer. So, let's all stand together to spread information, awareness about cancer. Welcome, Dr. Mahadev. So, Dr.
Thank you.
Mahadev Potharaju, thank you. So Dr. Mahadev Potharaju is a radiation oncologist, MD DNP at Adyar Cancer Institute, PhD at IIT Madras, who has 30 years of vast experience in the oncology field. Dr. Mahadev has published 25 papers. Presently, Dr. is working as a professor and HOD at Apollo Cancer Center in Chennai since 2004. Also, a senior consultant, radiation consultant at Apollo Cancer Hospital, Chennai. Worked as an associate professor at Adyar Cancer Institute, Chennai from 1996 to 2003. Now, welcome you all to the talk show. Hello, doctor.
It's a
So
pleasure to
today,
be here, Ashwini.
thank you, doctor. Thank you so much. So today we'll discuss about the radiation oncology, which you are specialized at. So my first question: what is the purpose of radiation treatment for cancer?
So, it is very important to understand that most of the cancer treatment is a multidisciplinary treatment. It is not just one treatment uh, which is important in the management of any cancer. So, usually the three most important modalities are medical oncology, which means chemotherapy and immunotherapy, then surgical oncology, which is the traditional surgery, and radiation oncology. Radiation oncology is the one which I have specialized in, and radiotherapy is a form of radiation treatment. That is, it involves the use of high energy X rays or high energy particles to kill the tumor cells. So it can be used in almost all types of cancers and some benign tumors also. That is, they need not be actually cancers. So many benign tumors in the brain as well, where we use radiation treatment. So it is, but what is important to remember is cancer is always a multidisciplinary treatment. It's a combination of either all the three modalities, in some cases only two modalities, very rarely a single modality.
Okay, doctor. That's really would have answered the many doubts that people had. So, when will the radiation be considered over chemotherapy?
So, one basic difference that we have to understand between radiotherapy and chemotherapy is that radiation is a local treatment. That means it has an effect only in the area that we are treating. Whereas chemotherapy is what we call as systemic treatment. That means it has an effect in almost all over the body. So it can attack any cancer cells present in any part of the body. So, uh, when we feel that the chances of the cancer spreading is very little, and it is important to control the tumor, where it is arose or where only in the surrounding areas, then it is either radiation or surgery. So, in very early stages, say for example, if you are discussing head and neck cancers, so whether it is nasopharynx or a tongue cancer or a cheek cancer or a throat cancer, very early stages, it is just either radiotherapy alone or surgery alone. And it is important that to remember that both will give equally good results. Okay, but as the stage progresses to stage 2 and stage 3, it is always a multidisciplinary treatment. So what happens is, say for example, a person has a stage 3 tongue cancer, or a stage 3 larynx cancer, or a throat cancer. Now, what we normally do is, the advantage with radiation treatment, so there it would always be radiation and chemotherapy. It is not radiation alone or chemo alone. So, in head and neck cancer, the thing to remember is surgery or radiation therapy is the main treatment. Chemotherapy is only a supportive treatment. Whereas, if you look like in blood cancers, leukemias, lymphomas, this is the areas where sarcomas, where chemotherapy is the main treatment. Okay, so that
Okay.
is something very important to remember. Also, in especially in head and neck cancer, in stage 3 and stage 4 cancers, we always talk about what is called as an organ preservation approach. Most of the throat cancers, tongue cancers are in people who are in employment. They need their speech to be intact for them to be functioning to earn their livelihood. So the advantage of doing radiation and chemotherapy is that there is almost a 60% chance that they will be able to preserve their voice, or they will be able to swallow the food in the normal way. So the quality of life is much better. But then we need to select the cases properly, as to say when surgery will be better, when radiotherapy will be better. But main thing is, in head and neck cancer, stage 3, stage 4 cancers, it is always radiation and chemotherapy as an organ conservation, so that the patient can lead basically a more a normal life. Okay. In stage 1 and stage 2, surgery and radiotherapy will give equally good results. And based upon the experience of a particular hospital or the particular personnel, and after educating the patient of all the pros and cons of each treatment, they can choose what treatment they want to have.
Okay. That was very detailed answer. So, how will the radiation therapy be given actually?
So once we decide that a patient is going to go in for radiation treatment, so that we decide based on certain investigations first. So first of all, a biopsy has to be done to prove that there is a cancer. Then some scans will be done. It could be a CT scan, it could be an MRI scan, and it could be a whole body PET CT scan. So especially in stage 3 and stage 4 cancers, there is a very high possibility that the cancer can spread to different parts of the body. So it's essential we know upfront whether there is any spread to other parts of the body. So once we know what is the stage of the cancer, then we can decide about how to plan the radiation treatment. So the first step is, depending upon the area that we want to treat, we need to first make some sort of an immobilization device, because radiation is like, shooting. So if you have to target the tumor very precisely, and make sure that the surrounding normal structures are not affected by the radiation. So when you're giving the radiation treatment, patient should not be moving at all. So that's the reason we have to do an immobilization technique. So normally for head and neck cancer, we make a mask. For the thorax, abdomen, pelvis, we make a sort of a vacuum cushion for them to lie down, which is custom made for each patient. Once the patient is put in a mask or a vacuum cushion, then we do a CT scan, an MRI, an angiogram if required. So this is what is called as a treatment planning scan, because on the scan we need to mark out on 3 dimensions what is the area that we want to treat, what are the areas that we want to avoid from the field of radiation. Then, after these contouring is done, then we hand it over to the medical physicist, who does the actual planning as to which direction from the radiation beams have to come in, how to avoid the normal structures. We normally say, okay, this is the maximum amount of radiation that can go to this normal structure, and things like that. So most of the head and neck cancers will require 6 to 7 weeks of radiation, weekly 5 days. Okay, there are different techniques of radiation available, but basically, more or less, this is how we plan the radiation.
So, like as you said, doctor, like I mean, it should be the person has to be immobilized during the treatment, right? So, how much time will it take for the particular radiation treatment to happen?
So yeah, so the immobilization device is a very simple process. It just takes about 5 to 10 minutes to make. So for example, in head and neck, it is what is called as an aquaplast. It's a thermoplastic material. So when we put it in hot water, it just melts, and when we put it on the head, it takes the shape of the head and the neck. And there are holes in the mask, so the patient is able to breathe normally. And with the mask, then we do the CT scan. The actual radiation treatment, by the time the patient goes in and comes out, it just takes about 5 to 15 minutes, depending upon what treatment technique we are using for a particular patient.
Okay. So, like as you've already answered, like it will take for head to neck cancer, it will take like 5 weeks. And generally, for all other cancers, like how many weeks it will take for a person to receive radiation?
Right. So, very important, because if we look at very early stage cancers, let us say, okay, let us say there is a tongue cancer or a cheek cancer, then there is a special technique of radiation treatment which is called brachytherapy. Brachytherapy is one where we are actually putting a radiation source into the tumor. So what we will do is we put tubes either through here or directly into the tumor, which will be done. This process will be done in an operation theater under anesthesia, and then after the patient has come out of the anesthesia, then the radiation is planned. There, the brachytherapy, we plan very high doses of radiation in a very short period of time. So a stage 1 or a stage 2 cancer, the entire treatment will be over in 5 days. So there will be one treatment in the morning, one treatment in the evening, and in 5 days the treatment is over. After that, those tubes are removed, and then the patient goes home. So for brachytherapy, it's an inpatient treatment. Patient has to be inside the hospital. There is no radiation source when the radiation is not being done. Radiation source is in the machine outside. The tubes are here, and only during the treatment the patient is taken to the treatment room. The tubes are connected to the wires, and the radiation source goes in and comes out. So there is no exposure to anybody else. And when the radiation is going on, the patient alone is in the room. Okay. So, for example, let us say there is a metastasis in the brain, and there is only one metastasis. Then we do only one single setting of radiation, and we give a very high dose of it. Similarly, suppose there is a very early lung cancer, very early liver cancer, very early prostate cancer. All these cancers can be treated in a very short period of time. And here it is not brachytherapy. So, for example, brain, lung, liver, prostate. Here we do a special technique called as a stereotactic body radiotherapy. And there the precision of the treatment is very, very high. So again, the concept remains the same: a very high dose of radiation in a very short period of time. So, but we have to remember that this short courses, that is only 5 days of treatment, are only for very early stage cancers. In any locally advanced cancer, so stage 3 and stage 4, it is always 6 to 7 weeks of treatment, weekly 5 days. So approximately 33 to 35 sittings of radiation. And mostly in all the advanced stages, we always combine it with chemotherapy. So there will be 5 days of radiation, 1 day of chemotherapy. 5 days of radiation, 1 day of chemotherapy. So, like that, about 6 to 7 weeks it will take to complete a course of treatment. The idea of giving chemotherapy is to increase the effectiveness of the radiation treatment. So, it acts more like a radiation sensitizer. So, this is how we plan.
So, what are the possible side effects of radiation therapy?
So, the side effects will depend upon the area that we are treating. So, for example, if it is a brain tumor and we are treating the skull, then there will be loss of hair only in the area that we are treating. But for example, if you're treating the throat, there will be no loss of hair because all the side effects will be limited to the throat. Sorry. So, if you're treating any part of the head and neck, some of the important side effects that we need to remember is that in the third week or fourth week, the patient may have difficulty in swallowing. There can be loss of taste. There can be, dryness of the mouth. There will be difficulty in swallowing, as I said already. So, and the skin can become slightly pigmented. So, these are some of the important side effects that we see. Suppose we are treating the pelvic area, so let us say a cervical cancer, or a prostate cancer, or a rectal cancer. Then the side effects will be there could be burning sensation in the urine, frequency of urination, similarly, frequency of bowel motions. So, it depends on the area that we are treating.
Okay. So, does a person emit radiation? So, it's like a general, I mean, myth, or I could say, or a general thought prevailing among the people, among the public. Like the person who's taking radiation, they are will they emit radiation even after the radiation therapy? And are there any restrictions that they should not visit the children or they should not go near the pregnant women? So, how is it done?
Yeah, so that's a very important thing because we keep hearing about this, and we also have, some uh, people who are working in the hospital, young nurses who will be very scared with the word of radiation itself. No, no, we don't want to work in the radiotherapy department. It will affect our periods, we'll become sterile, and all this. So, actually, when you're giving radiation treatment, the radiation is in the machine. There is no radiation inside the body. And when the machine is on, the radiation goes in, treats the area. After that, there is no radiation inside the body. So it is a myth to say that there will be radiation inside the body at any point of the time. There is just one particular type of radiation which I'll come to, where the radioactive sources can be inside the body. But then, even in those places, we don't. The patient will not be allowed to mingle with others until the radioactivity source is gone off. Most of it, 99% of the radiation treatment, there is absolutely no radiation inside the patient. There is no need to isolate them. They can mix with their relatives, they can play with their children, grandchildren. One of the most important thing we see, all old people, they're scared that the children, the grandchildren will be affected. Absolutely nothing. They can share the same glass, they can share the same vessel, they can play with their children. And also, cancer is not contagious, radiation is also not contagious.
Yeah, it's sometimes very disheartening to see like the that is the moment when the survivors need at most love and affection, where people tend to avoid them, thinking like they may harm the
Correct.
family members or.
Correct. And it has a tremendous psychological impact because I have
Yeah.
seen during the long course of this thing, marriages have broken down, and people have left homes and gone off, and it unless and this is because of all these myths only. One is it is contagious, one it is not curable. It will have an effect on this, it will have an effect on that. It can pass on from one person to another. So you're absolutely right. These are myths which need to be really cleared up.
Thanks, Toka, for clarifying that so that people at least they will understand. People who are watching this talk show, like how much affection and the care they need actually the survivors. So my next question: can a person take any alternative treatment? Because I have heard like some people asking these questions, like whether they can take Ayurveda treatment while undergoing this the radiation or chemo treatment. So how much safe it is, doctor?
Yeah, I think what is important is that there are too many Ayurvedic medicines available in the market, and we are not sure about the standard of these drugs. If these are the traditional medicines, then I can understand. Then it should not be a problem. but there are so many that it is very difficult to keep a quality check on what type of medicines one is taking, whether he's a qualified doctor or not doctor. Or it's just the over counter. Somebody said, I took it, I became absolutely all right, you take it. And many times these things happen. So that is the reason why I would be very hesitant to combine it with the traditional treatment when the treatment is going on. You do something after that also. If you want to take Ayurvedic treatment after that, you have to make sure that they are actual genuine doctors, which not trying to make a quick buck or something, but and it has a proven. See, unfortunately, I'm sure there must be some useful medicines in Ayurveda, homeopathy, and everything. The problem is there are no scientific studies to back it. And so those are the issues which we are not coming forward. We don't do clinical trials and studies to actually say that this will be useful. I'm sure traditional medicine is there, that is fine, but ultimately it is the integration of all these things which will really make a difference to the patient. For that we need scientific data. Otherwise the medical community will never agree to anything.
Definitely. That is true, doctor. Like we need to know the authenticity of a person before get going to them.
Absolutely.
Yeah. So, like any foods to avoid in general during the radiation treatment.
So normally avoid hot and very hot, very cold food, very spicy food. There should be a high protein diet, especially at least 60 grams of protein in a day, provided the kidneys, everything are functioning properly. And what is more important also is that if a patient is fit, he must be physically active. Most of the time, it is like telling them, no, 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 you have this, don't walk, don't do this, don't do that. And there is absolutely zero physical activity in the patient, and they become dull and they become depressed. It's very important that physical activity, whatever they can do, 15 minutes, 20 minutes, half an hour. And we have now data showing that physical activity actually plays a very important role in counseling, physical activity. These are things which have not been really studied in depth, but we are knowing their benefits now.
Definitely.
So
So,
diet, counseling,
yeah,
fitness.
all the three. Yeah.
Yes.
Sure. So, what are the chances of cancer reoccurrence in general, like after the radiation treatment?
So it will again depend on the stage of the cancer, the site of the cancer, where it is. So, as a thumb rule, we can say that earlier the stage, better are the chances of cure. So, in stage one and stage two, we would say the chances of cure would be more than 90%. If you take so when we are talking about a cure in cancer, it is not that you treat now and it becomes all right. That is not a cure, that is only a response. So usually what we do is we follow up the patients for at least 5 years, because most of the recurrences after cancer happen in the first 2 to 3 years. And after that it becomes less and less possible. So if a patient after completion of treatment there is no recurrence till 5 years, then only we say that a person is cured of the cancer. So when we talk about cures, we have to be very careful what we are actually saying. It's not I treat now, within 6 months the patient becomes all right. That is not a cure.
Okay.
So that is why we always talk about 5-year survival rates when we are talking about any cancer. Because if the cancer doesn't recur within 5 years, it is very unlikely that it will recur after that. Recurrences can still happen after 5 years, especially in breast cancer and some of the other cancers, prostate cancer, but it is rare.
Okay, doctor.
And
So,
as it becomes locally advanced, the chances of cure becomes less. So if you're talking about stage 3 and stage 4 cancers, we would be looking at 40 to 50% 5-year survival rates.
okay. So, as we have already, you have all answered this question. Like the person will be able to do the exercise and be normal during the treatment. So, what are the other? Will they be able to do all the daily activities like, for example, carrying some heavy weights or going to the office, um, or all the other, like for example, if a breastfeeding mother, can she feed the baby? During or after the treatment? Especially during the treatment.
So breastfeeding, not because of radiation, but when a person is pregnant, first of all, we don't offer radiation at all. That is
Okay.
one. And after the pregnancy is over, then also it is probably breastfeeding per se may not be harmful, but unless we are sure that the treatment is completely over and they are not getting chemotherapy as well, because some of the medicines which you're taking can be secreted through the milk of the in the lactating breast, so that can affect the baby. So these are some of the things which we will need to keep in mind. But regarding other things, going to the office, almost I can say that 50 to 60% of the patients who are on radiation treatment and chemotherapy also will be able to attend their uh, office work if it is light duty, if it is like a desk job or something like that. If it is a short course radiation, many of them just walk in, walk out, and either they come in early morning before their treatment, before their office, or they come after they finish their office and have the treatment. So, really, I mean, one of the things is that you should never be just sitting at home and think, not even go out. And I can see overprotective
Yes.
parents, overprotective wives, overprotective husbands, not allowing what the patient really actually wants to do.
Yes. So, is it fine, doctor, like exposure to the sunlight and everything during the treatment, radiation treatment?
Yeah, so
Or,
exposure to sunlight, I think, is it better to avoid when you're taking direct sunlight, but there's no problem in taking an umbrella, wearing a cap or a head, and just walking around. It is always good to go out and get some sunlight. Direct sunlight falling on the area that we are treating will tend to aggravate the skin reactions to some extent, but otherwise,
okay.
it's not harmful in any other way.
Like early
And of
morning
course,
walk would be better.
absolutely, yeah, early morning walk will be good. And also, one thing is you should never go into crowded places when you're undergoing either radiation or chemotherapy or surgery. That is absolutely, even we go off to temples thinking all sorts of things will happen in temples, but
True.
it is better to avoid all the crowded places, whether it's a temple or a cinema hall or a restaurant or anything.
Okay, doctor. So, what would be the follow-up procedure after the radiation treatment?
So, usual follow up that we follow for most of the cancers would be after the treatment is completed. The first checkup would be after 6 weeks to 8 weeks. And in the first year, it will always be at every 2 months, because the maximum risk of recurrence is in the first year. Once the first year is completed, and that usually it will be just a general clinical examination. If it is a brain tumor, we may have to do an MRI scan after 3 months to assess the response. Sometimes in locally advanced cancers, we would ask for a whole body PET scan to see the response. But once that is done, then it is just a general examination. Then after 1 year is completed, once in 3 months. Once 3 years are completed, then it is once in 6 months. And if 5 years goes off without any problem, that just once a year.
Okay. So, like all the questions you have answered so patiently for all during this, like 40 minutes talk show, doctor. Thank you so much for being here and being so patient in your, and you've answered like so descriptively in a detailed manner. Definitely, people who are watching this talk show, they would have understood the importance of the treatment and the importance of being there for the survivors, and also the survivors themselves, they would have understood like it is not a very difficult phase for them if they if they cooperate with the oncologist, and if they take good foods and everything. This would really, they'll be able to come out of this in a in a very graceful manner. So thank you, Doctor, for being here and educating everyone.
Thank you, Ashwin.
Yeah,
And
thank you,
I
Doctor.
think
Thank you
you're
so
doing a
much.
great job. Keep it up.
Thank you so much, Doctor.